My name is Rebecca Porter, and I'm a mother of 10 kids. Things have changed. When I was younger and had just a couple kids, we went to the park and we walked everywhere. I rode horses. We did a lot of different things. And then as they've gotten older, I find I'm standing more on the sidelines and sitting there and talking to other moms, but my heart wants to be out there. My head kind of went, that doesn't seem normal. And I talked to my girlfriends and they all said it was normal. And that's just what you have to live with being older. And I thought, I don't really want that. I want something different. And then after talking to several people, I thought there are options out there. Why don't I try them? And if it doesn't work, it doesn't work. And if it does, then what a blessing. And I want back my active life again. So when I first came, I was a little nervous because I wasn't sure. I was like, what does she do? This sounds kind of weird. Can she help me? I don't know.
My name is Sonal and I'm a physical therapist. I finished my doctorate in physical therapy and I'm board certified in pelvic health.
Sonal was great because she taught me things and showed me how all the muscles relate and helped me to understand what was happening in my body.
I'm trying to understand where they're coming from, what's bothering them. I'm doing a pelvic exam. I'm doing a pelvic muscle exam. It's not like a OBGYN does it. And it may involve running outside or jumping on trampoline or just assessing the activity that they cannot do.
So one day Sonal said, hey, come in here, Rebecca. We want you to jump. And I said, Sonal, I can't jump. I've only been to see you a couple times. And she was very confident in using the skills I had already learned from her. And we went out into the front room and she had me stand there and jump. And I was scared. I kind of held everything in. I thought, typical routine, hold in that bladder, Rebecca. Don't let it go, you're in public. But it worked. It was amazing for me.
The STAR physical therapy program is very special. It's one-on-one. A lot of physical therapy clinics now will tell you that, oh, you got 30 minutes, you got 20 minutes, you got 10 minutes with the patient. And I told STAR that that's not enough time for me to understand the women. That's not enough time for women to open up and tell me her issues. I need an hour to talk to them, to understand them, so they feel comfortable with me to share their private pain or private issues. And STAR gives me that.
Coming to see Sonal at STAR Physical Therapy has given me back my active life and the chance to laugh and not worry. We don't have to suffer. We don't have to accept what's happened to our body as we age.
Just giving birth is not an excuse to have accidents or not be your 100%.
It's a simple step. Like, it's really simple. You don't have to have a doctor to certify you to come here. You can decide that you want to go see a pelvic floor specialist for yourself. But the truth is, we can't serve our families. We can't serve other people in the community if we're not in a good shape ourselves.
To the women in the community, that it is not okay to have accidents while doing what you love to do. Go get help, and get help from physical therapists and their direct access. Go see them, and that will make your life better.
Now I can stand and work with a mom at birth, and I don't hurt in my hips, I don't hurt in my knees. It's just great to be able to be on my feet for like 10 or 12 hours and not have pain and discomfort, where I've lived with that for years and thought that's just what we wouldn't do. We just have to do this. And now I know that's not true, that there is hope and there is change.